Hi, my name's Claire. Welcome to this movement class for women who have recently undergone surgery for breast cancer. I myself have just had a lumpectomy and a full axillary clearance, and I'm doing the exercises in this class that the NHS suggests you do when you get home. So you can do these seated, standing, or standing, so I'm going to demonstrate them standing today. I think it's start by bringing your feet just a comfortable hip distance width apart. Maybe just scrunching up your toes and releasing them down. So there are fascial connections all the way through the body. So even though we are going to be doing some movements to help support the mobility and range of movement around the chest area, simply bringing some awareness to the feet and some movement into the feet and the hands and will aid healing through the whole body. And especially when we are looking to reduce risk of lymphedema, any movement of circulation in the body is helpful, and that's where the breath comes in as well. So, lying in bed with conscious breathing exercises can be very powerful in your healing journey. So once you've scrunched up the toes and spread them back down to the ground, become aware of your feet being the support of your body. So our support comes from our feet up. So there's a sense of lifting upwards through the bodies and then allowing your arms to relax off of your shoulders. So there's almost a sense of weightlessness through your arms, and allow your fingers to curl in. So we're starting from a tension-free place. Allow your breath to settle. Maybe bringing your awareness to your breath, just noticing the rhythm of the breath. Maybe you can notice where your breath moves your body. Does it move the chest or the belly, the ribs? Can you not notice any movement at all? Just whatever's true for you. And then bring one hand onto your belly and one hand onto your lower back. And see if you can have a sense of the breath gently expanding the front and the backs of your bodies. So there is a fullness to the breath, a sense of expansion as you breathe in, relaxation as you breathe out, almost like an emptying, a newness as you breathe in, and a letting go as you breathe out. Notice if you're breathing in through your nose or through your mouth, and see if you can set an intention to breathe through your nose, so that really affects the quality of the air that you breathe, and it affects the quality of your breath in your body, and it affects the chemical changes that go on in your body. So breathing through your nose, inhaling through your nose is very valuable. And then what's the rhythm of your breath like? See if you can allow your breath to have the same length inhale and the same length exhale. This is very good for balancing the body. So a balanced breath helps a balanced mind, helps a balanced body. So before we begin any movement practice, coming from a place of relaxation and a steady, even breath through the nose is going to give you the best possible starting place. Your arms relax down by your sides, fingers gently curling in. As you inhale, gently bring your shoulders up towards your ears. As you exhale, the shoulders gently draw down. So there's a sense of linking breath to movement. Inhaling, rising up. And exhaling down. Now start with very small movements and slowly increase your range if it feels comfortable. So there's a sense of you listening in very carefully to what's happening through your body and adjusting your movement accordingly. So there is a relationship between you and your body that's helpful, that's nurturing, and that's kind. So one more, inhaling as the shoulders come up. Now the shoulders there's a sense of the shoulders moving away as they draw up. So there's a sense of expansion across your chests. Exhaling and gently lowering down. So next you're going to inhale, bring your shoulders gently out and up towards your ears, and exhale round and down. Be very mindful with this movement. You might notice a lot of crunching, in which case it's quite good that you're doing it, so we can move through that crunching to find some space and some release, some pliability. But this might also trigger some nerve activity that feels a little bit unpleasant. And if that's true for you, then you might just choose to limit your range a little bit. Use your breath to gently move through it. But if it's too much, reduce your range of movement. You will notice with each day it does ease. And when you're ready, very slowly reversing that range, bringing the shoulders back first, then forwards and down. Again, we're not looking to come to our maximum range of movement here, depending on where your starting point was. Yeah, so just be really kind to yourselves. If you're feeling really like muscularly stiff, then that is a sign to, bring in as much movement as you can. Stiffness around the shoulders is good to move, but if it's strain and tension coming from the wound site, then listening into that. Okay, but knowing that movement is healing. So we're not coming from a place of fear. We're moving from a place of love and kindness and truth. An element of healing movement will help us heal. From there, bringing your hands onto your shoulders. Okay, moving slowly and mindfully at every step of the way. Inhaling, the elbows point forwards, and maybe just come halfway to start with. Exhale as they lower down. So there's still a sense of linking breath to movement. If that felt comfortable, you might come up another inch or centimetre, inhaling forward, exhaling, lowering. So these exercises are for people in the first week of post-operation. So the elbows aren't coming higher than 90 degrees. They don't have to come to 90 if you're not feeling ready for that yet. But I invite you to explore. Yeah? Notice and just see. You might find that as you move gradually, each time you can come up just a little bit higher. Once the elbows, notice if you're leaning back as the elbows come up, and if you are, try and ground down to the mount of your big toes and lift your ribs away from your hips. So there's activity, a little bit of activity coming up through the body. And exhaling down. Now as your elbows come up and you're breathing in, see if you can get a sense of the breath moving the back of the body as well. Inhaling and exhaling to lower. So if you've been lying in bed quite a lot, resting and healing, which is fantastic, it can be a really good opportunity when we're standing to feel the 3D nature of the breath. So your elbows are now coming out to the side as you breathe in, and exhaling and lowering. The soft, gradual breath, soft inhaling and exhaling through the nose, but see if you can get a sense of the breath moving the back of your body as well as the front. Okay, so 75% of your lungs are posterior, which means at the back. You can access your breath functionally very well by lying on your fronts, which is hard to do, obviously, after surgery. So standing up gives us that opportunity. One more time with the elbows coming out to the side, listening in all the time. Exhaling and lowering. Okay, so relaxing your arms back down by your sides. Again, moving every time you move with awareness. And bringing arms behind back. This is called the winging. So I suggest you start with the side you didn't have surgery on if you had surgery on one side. Otherwise, have to choose the side that you had the minimum amount of surgery on. And bring your hand behind your back. And you can hold on to the elbow of the other side, which might offer you just a little bit of support. And keep the arm close into you on the side, on the opposite side. And you might stay here. Or you might be able to creep your arm a little bit up your back. And you could use any clothing that you're wearing to help you creep your arm up. Bring your palm to face outwards if you can. That will help your shoulder at the front to internally rotate as the arm comes up. So where we come to now is going to depend massively on the range of movement you had before your operation. So don't worry where your arm is coming, just be where you are now in your moment with your breath. And it might be that you're here. And just being there and breathing is going to be very beneficial. Slowly reducing down, coming onto the opposite side. So if you bring your palm to face backwards, spinning your thumbs down, that will help the shoulder to internally rotate. And from there, the arm comes behind the back. And you could start by bringing your hand just onto your bottom. And this could be where you start. If that feels okay, slide it across to the opposite bottom cheek. Yeah, so you can dance between your bottom cheeks with your hand. And then see if you can find the elbow of the opposite arm. And that might be where you stay and take a few breaths. Remember, not rushing. Noticing how things are feeling. There might be a little bit of release, a bit of tension, a bit of pliability, stretching sensations. And as you bring your awareness there with your breath, you might find that change or shift. You might find it increases intensity and decide to bring your arm a little bit lower down. So really taking agency for what is right for you in this moment. And then you might see if you can bring your hand a little bit up your back. Okay, remembering there's no hurry or rush, but moving where is available for you to move is very important. Yeah, so we're not comparing, you're just seeing where we're at in this present moment. Just coming back to that breath, that sense of moving around the ribs, lower down the lower part of your lungs. So there's no excess tension coming up into the neck and shoulders. Shoulders completely relaxed. If it helps to bring a hand onto your belly to encourage the breath to come down lower, then please feel free to have that point of contact. Slowly and mindfully bringing the arm back down. You might like to come through the holding of the opposite elbow. It might feel right for you to pause here before you gently bring your arm back down by your side and releasing. And allowing your arms to relax. Maybe taking a moment to observe how your body's feeling, how the tissue's feeling after that movement. Okay, remember, each time you do this, it can feel different, and that's okay. Part of the process. So now we're going to do the hands behind the head. So being extra careful with this as the arms come up, interlace the hands behind the head, and keep the elbows forwards when you start. Hands behind the head, lengthening up through the spines. Inhale your arms, come out to the side, and exhaling them forward. So I've just come out halfway to start with, listening into what's happening. I can feel a few twinges down the back of my arm. That's normal. So, nerve sensation can feel quite sharp. Maybe sometimes it can feel like lightning. So really listening in. Inhaling as you open. Exhaling as you gently draw in. time. Inhaling, gently open. Exhaling as you gently draw in, release your arms back down. And relax your arms down by your sides. Inhaling, arms up, back, circling through your shoulders. You might notice a difference to how the shoulders feel when you roll them now to when you rolled them at the start of this movement practice. You might not, but just noticing whatever's there, maybe just a little bit more space. Movement capacity in reverse, come round in the opposite direction. And inhale, gently bring your shoulders up and exhale to lower. Again, listening in. Inhaling, arms up. Exhale, lower. Linking breath to movement. Noticing the expansion of your waists and your bodies with your breath as you breathe in. Noticing that you can really stretch your tissue with your breath. And gently releasing your breath back down by your side. Inhale, you're grounding down through the feet as an upward lift all the way through the body as you support your body in this standing upright posture. And then gently bring your right ear down to your right shoulder. Maybe bring the left palm to face forwards. And draw a little semicircle with your nose. Releasing through the soft tissue at the side of the neck. Opening and closing the jaw if that feels right for you. Inhale, gently bring your head on top of the spine and switch sides. Inhale, lengthen. Exhale, left ear to left shoulder. Right palm faces forwards. Being aware of the space that's being created. And gentle semicircles. Opening and closing through the jaw. Pressing into the balls of the feet as you gently float your head on top of your spines. Just taking a soft, slow, gradual inhalation and exhalation. Noticing how that moves your spine. If it's comfortable to bring one hand onto your chest and one hand onto your belly, feel free to do so. Otherwise, keep your hands resting by your sides. As you inhale, feel the breath travelling from the crown of the head down to the root of your spine. As you exhale, visualise the breath travelling from the root of your spine up to the crown of your head. Inhaling the breath down from the crown of the head to the root of your spine. Exhale the breath from the root of the spine back up to the crown of your head. So visualising the breath travelling up and down your spinal column, the centre of your spine, your central axis, your sushumna. And visualise the breath bringing in fresh, oxygenated, healing energy as you breathe in. And then letting go of any waste products as you breathe out. inhaling in the newness of life and exhaling all that has passed. Sending some love and some kindness to yourselves. Thanking yourselves for taking the time to do these valuable movement practices that are going to really serve you so well as you continue along your healing journey. Thanking your body for having the amazing capacity to heal, to adapt, to create new neural pathways, new neural connections. And trusting our minds to feed our bodies with information that will allow the body to heal. And just giving yourself a smile of reassurance. Really, our job is to create space for our bodies to do what it already knows how to do. Your body knows how to heal. And just inhaling a sense of peace within that knowledge and that truth. And exhaling any sense of fear. Inhaling peace. Letting go of any fear or tension. And I invite you to interlace your fingers and place them over an area that feels comfortable for you to do so. So you might need to bring it up slightly towards the throat. Maybe you can bring it over your heart centre. It can be a very light touch. So this is a mudra of unshakable trust. So place this mudra of unshakable trust over a part of your body that feels comfortable. Trust in yourself, trust in your body, trust in your mind, trust in your spirit, and trust in the process of life to bring you your highest good. Sending all of my peace and trust and love and light to you. Namaste.